monsoon intensifies in Bengaluru. Dengue cases have risen significantly in the last 2 months, recording a 400% jump. The city has seen 1,036 cases in June alone, and this has set the alarm bells ringing.
Karnataka has witnessed a sudden spike in dengue cases. What was 200 cases in the summer months turned into 797 in May and 1,036 in June, putting Bengaluru city on guard. 20-year-old Debarjo Basubal is one among those affected by dengue. A sudden fever brought his platelets down drastically, and he is now on his road to recovery.
It was worse. My parents had to come down, and I live in a PG here, and I thought it's a very clean PG, which it moderately is, but then the water that accumulates, you never know how dirty the water is, how dirty your surrounding actually is, what leads to the rise of these kind of mosquitoes, and you never even know what kind of mosquitoes lead to dengue. So I think I needed to be a little bit more clean, and I needed to be a little bit more careful.
Addressing the sudden surge in cases, CM Siddaramaiah called for a meeting with officials of the Civic Department and Health. Chief Civic Commissioner, who was also affected by dengue last week, said that the municipal corporation will be holding a survey across 14 lakh houses to destroy dengue breeding areas.
Because of intermittent rain and conducive temperature of 26 to 30 degrees, the breeding and the mosquitoes numbers have gone high. So we have to now pull in our all resources and intensify our survey work. Survey work is very important.
From January to May, dengue cases in Bengaluru jumped by 59% as compared to 2023. Karnataka has recorded 5,374 cases, 5 deaths till date this year. Bengaluru has witnessed 2,447 cases till date this year. More cases reported from Bengaluru, Chikmagaluru, Mysuru, Haveri, Shivamogga, Chitradurga and Dakshin Kannada districts. More than 40% of 50 patients walking into hospitals with fever are reportedly testing positive for dengue, say doctors.
First things is that the rains are going to be around, so we cannot prevent that. So what can we do for that? Make sure that the area where you stay is maintained with good hygiene. There is no treatment for dengue. It's a virus and it's only symptomatic. So when I say symptomatic, if a patient is having fever, you treat for fever. If a patient is having body pain, you treat for body pains.
While the government must initiate efforts in destroying mosquito breeding areas and boosting treatment measures, the onus is also on you and me to ensure our surroundings are clean and to keep dengue at bay. With camera person Govind, Pratibha Raman in Bengaluru for NDTV.